Great. So hi, everyone. Thank you so much for joining. I'm sure you're all aware that we are here today to participate in a two-part climate-focused event hosted jointly by the International Institute for Sustainable Development, as well as the Youth Climate Lab's RAD cohort. Today, we are enjoying a panel discussion on the topic of environmental policy and how it can ultimately impact human health and well-being. My name is Emily Kroft, and I am a Youth Engagement and Water Policy Officer at IISD.
My name is Shivani Solanki, and I'm a member of the 2021 VAD cohort at Youth Climate Lab.
I would like to also give an extra special welcome to the people who helped plan this event today from YCL. So I would like to welcome Jason Robinson, who will also be a panelist and is a member of the 2021 RAD cohort. And also welcome to Celeste Alsena, who is Youth Climate Lab's Community Manager. I want to start out for today by acknowledging that Canada was built on the stolen lands of hundreds of Indigenous nations, and that justice has still not been had. There is significant work that remains to be done to promote Indigenous rights, autonomy, and inclusion in Canada. We are all joining today from different parts of the country, so the nations whose lands we are on will be different for all of us. If you do not know whose land you are on, I would encourage you to find out, and you can do that at nativeland.ca. For me today, I am joining from Treaty 1 territory, the traditional territory of the Cree, Ojibwe, and Anishinaabe people, and homeland of the Métis Nation.
I acknowledge my presence as an immigrant settler joining in from Treaty 6 territory, the traditional lands of the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, and Inuit. So before we begin, there are some Zoom functions to review. We have a Q&A after the panel where you can ask questions. So we ask that you use the Q&A function that's highlighted right here using the red arrow to put in your questions. So we can go ahead and introduce our speakers for today's panel. Our first panelist is Isabella Richmond. Isabella is an early career biologist and environmental scientist who is currently writing her PhD dissertation on the topic of ecosystem services in urban areas. Her current work focuses on ecosystem services in the city of Montreal, Quebec. Joining us as well is Manvi Bhalla. Manvi is a co-founder of a youth-led climate organization, Shake Up the Establishment, and she was listed as a top 30 under 30 sustainability leader by Corporate Knights. Manvi's advocacy takes an intersectional approach, centering climate issues in perspective of other important social justice issues that are related. Much of her current work focuses on the intersection between climate justice, health policy, and the social determinants of health. Our third panelist is Peter Julian. Peter is the MP for New Westminster Burnaby in British Columbia, but his reason for joining us today is for his incredible work on the motion M-1, otherwise known as the Made in Canada Green New Deal. This proposed motion calls on Canada to take drastic action to fight the climate crisis, fight the oppression of marginalized communities, and honor all treaties and agreements with First Nations, Inuit, and Métis people. Our fourth panelist is Dr. Lesley Brennan. Dr. Brennan earned her PhD in cell physiology at the University of Alberta in 2011. She then studied pregnancy and resulting complications on mother and children as a postdoc fellow before earning her MPH, her Master's in Public Health, in 2015. She has a strong interest in environmental health, particularly exposures during pregnancy that may threaten the health and well-being of the child. She has worked with the Children's Environmental Health Clinic since 2014 and is the director for the group's WHO Collaborating Center in the Child Health and the Environment. Leslie coordinates and supports clinical research studies in the Department of Pediatrics at the University of Alberta. Our final panelist is Jason Robinson. Jason is a graduate of the Master in Environmental Studies program at York University with his area of concentration in ecological economics. Current roles Jason holds are data analyst for the Rural Ontario Institute, policy specialist for the Community Climate Council, and co-founder / research and data lead for Gradient Spaces. As a data analyst for ROI, He is responsible for the research on various socioeconomic issues that affect residents in rural Ontario. As a policy specialist, Jason works with the research and education team to develop and execute strategies to increase environmental awareness and climate literacy within the Peel region. As co-founders of the Gradient Spaces, a space for 2S LGBTQIA+ people passionate about making tech more equitable space, he works on collecting data to address the issues of queer people in the tech ecosystem. Jason was recently selected as one of the North American Association for Environmental Education's 30 Under 30 for 2021. Okay, so to begin, I'd like to ask each panelist to summarize their current work for us. We'll start off with Jason. Jason, can you tell us a little bit about your work in the field of environmental economics and policy?
Well, I kind of think my intro kind of basically did all of that. But kind of go into more in detail, kind of with ecological economics with my grad school. I did my master's research on socio-ecological approach to measuring well-being for Ontario's transition into a green economy, as I feel like a lot of times when we talk about transition into the green economy, we don't kind of look at we go back to the same old ways to measuring well-being, which is kind of problematic. So it's kind of looking at the different aspects of looking like into health, looking into all these different aspects that affects overall well-being in society, as GDP only just covers like the financial parts of that. And that has led me to work as like a data analyst at York at their Ecological Footprint Initiative, where I was doing my ecological footprint counting for the Ontario State Biodiversity Report. And that also been doing work at the Community Climate Council right now, developing a research and policy hub that's making more climate literacy more easy for like youth and the larger Peel region, as we feel like it could be too much jargon in it. So that's kind of a big problem we realize. And currently right now I work at rural Ontario, creating what are called fact sheets on various socioeconomic issues. Like the last two I've been working on will focus on like COVID related issues. One that's released right now, other one will release very soon on more of the overall economic rebound that's going on right now with rural Ontario.
Thank you for sharing. We're going to turn to Bella now. Bella, can you tell us a little bit about your current scientific research?
Yeah, thanks. I'm currently doing my PhD at Concordia University in Montreal in the Zeder Urban Landscape Ecology Lab. And my research focuses on the benefits that we get in cities from urban nature, and more specifically from our urban forest, which is just all the trees that we find in our cities. And so I'm looking at the benefits, specifically the kind of more physical benefits. So like temperature regulation from shade from trees and flood mitigation and that sort of thing, but also the human health benefits from those things and mental health and just the associated benefits of nature and how those benefits are distributed in our cities. So spatially, like who's getting them and why are those people getting them? And then also how do our past decisions impact who's getting those benefits today? So yeah, thanks for having me.
Thank you. I'll turn to Manvi now. Manvi, can you tell us about your work on the intersections between climate justice and health issues?
Yep. Thanks everyone for having me. My background, actually my bio didn't cover a lot of my degrees. I have a bachelor's in biomedical science and a master's in public health and health systems, so really health oriented. And my master's thesis is actually on climate change and public health authorities in Ontario and like, do they care? And the answer is really long. I will try to summarize it eventually, but for now it's available online. But now I'm doing my PhD at UBC and I'm at the Institute for Resources, Environment, Sustainability. So alongside, my voluntary work and professional work with Shake Up the Establishment, which is a climate justice youth-led organization. I'm doing my PhD in environmental decision-making and how we can bring in Indigenous and racialized and particularly gender-based perspectives more meaningfully within like shaping the decisions that we make upstream for environmental policymaking, and in particular, like looking at things like how a lot of Indigenous and racialized communities are disproportionately impacted by things like, adverse health outcomes because of exposure to pollution or exposure to toxins and chemicals. Management upstream needs to be better. So trying to look into how do we inform, things like SEPA and like the right to a healthy environment, and how do we actually meaningfully involve the communities that are the most impacted, in particularly with their health, as a result of how we manage and make these decisions about our environment. So that's how I think academically, I've been doing stuff. But then, yeah, obviously in the voluntary sector, just love working with Shake Up the Establishment's team and always trying to find ways to work directly with the communities and that are most impacted, and also trying to help with campaigns and awareness and policy advocacy, and doing so in a nonpartisan manner to try to bring people together over addressing the climate crisis. I think that's more than enough. So I'm really happy to be here and excited to hear from all the other panelists and yeah, learn together.
Awesome, thank you. We'll move on to Peter. So Peter, can you please summarize the propositions that are contained within motion M1?
Yes, thank you very much. And I'd like to start off by acknowledging and appreciation that I'm speaking to you from the traditional territories of the Kakite First Nation and the Coast Salish peoples. And I'd like to thank Youth Climate Lab and the International Institute for Sustainable Development for holding this webinar. This discussion is very, very important. In British Columbia, we lived through some of the impacts of climate change and the climate crisis just over the last few months. There was the heat dome that happened in June. That killed hundreds of people. And in speaking to firefighters and ambulance technicians over that period, they said that if the heat dome had gone on for a few more days, the healthcare system would have collapsed. They simply couldn't keep up with the number of people that were in distress over this time. That was followed by a bomb cyclone that also caused a significant loss of life and property damage with the high winds that blew over trees that have stood for centuries. And then we've had the atmospheric rivers that have flooded many parts of British Columbia, cut British Columbia off from the rest of the country for many weeks, and also led to loss of life. So there has been a profound impact that we have felt here in my riding of New Westminster Burnaby and right across British Columbia because of the climate crisis. So what we need to do is have a sea change in attitudes, and that's where Motion M1, the Green New Deal, comes into effect. It's part of a global initiative. There is a global alliance of Green New Deal elected officials statements that have been signed by hundreds of elected officials right around the world, representing dozens of countries. And so similar legislation is being brought forward in a number of different legislatures and parliaments. Alexandria Ocasio-Cortez and Senator Ed Markey initiated it in the United States. I'm the initiator in Canada. And what M1 seeks to do is to really shift us to a clean energy economy. Now, I should say that the term New Deal comes from Franklin Delano Roosevelt in the 1930s, and New Deal legislation that transformed the inequalities that took place at that time in the United States. The Great Depression had ravaged middle class and poor Americans. The New Deal was designed to bring more equality and a type of economic initiative that benefited everybody. And so what the Green New Deal entails to do is the same thing. First off, as part of the Green New Deal, what Canada would endeavor to do is shift to a clean energy economy. What that would mean is net zero within a span of a few years. What that would mean is rather than expanding fossil fuel projects, we would be looking to invest in the smart grid that many other countries have seen as very useful to in ensuring that we put in place new clean energy possibilities, alternative energy sources, things like solar and wind power, to make sure that that's put into place. So that is our primary focus as the economy. Secondly, it transforms the economy in a whole range of other sectors. Manvi talked about the health impacts on people, and the reality is we can't have environmental justice without social justice and economic justice. And that means putting in place the kinds of investments that ensure that everybody prospers. All of this comes as a result of a different approach, which is bottom up rather than top down. So it's through consultation, particularly with Indigenous peoples, particularly with racialized peoples, frontline and vulnerable and marginalized communities, that putting in place the Green New Deal makes such a difference. So in short, what we're looking for is a transformation of Canada's economy, bringing and putting into place environmental, social, and economic justice. That starts with the adoption of Motion M1, but that is the start of a process that will take us a number of decades to put in place all of the investments that are required and to ensure that we have really built a society that's equitable for everybody. Some people point out, well, there are costs that are involved in putting into place a Green New Deal. The reality is, though, that cost of climate change, as I mentioned earlier, not just in human lives and property damage, but increasingly is costing our economy. $5 billion last year, even more this year. And we're seeing estimates ranging up to $50 billion a year over the next couple of decades unless Canada makes this transformation. So I encourage everybody to get involved. And if you want more information, you can go on my website, peterjulian.ca. We really need to have this push to get Parliament to adopt Motion M1, the Green New Deal. Thank you.
Thank you, Peter. And we'll also share the ways to get in contact with all the panelists at the end too. We have like emails and everything there. Moving on to our final panelist, Lesley, can you tell us about your research at the Children's Environmental Health Clinic and specifically about your work around climate change and other changes that you see in your research and in your work over the last couple of years?
Yes, thank you. And first of all, thanks for inviting me, and amazing work setting up this panel and all the things you're doing. It's amazing to see you taking the lead on this. I love it. So you did mention in my bio, so I won't reiterate too much, but yes, I work with the Children's Environmental Health Clinic based at the University of Alberta in Edmonton. I didn't give you the website for that yet, but I will. The clinic focuses on specifically environmental exposures in children's health. There is a clinical component at the clinic, of course, where we see children with exposures, a research component, which I am specifically involved in, and an education component, which focuses on educating both the clinical community and the community at large about environmental exposures. As you mentioned, one of the exposures we do worry about is climate change. People don't even understand how many things are related to climate change that affect children's health. There are wildfires, there are droughts, there are floods. There are new diseases that are occurring now because of changes in the climate that we are not used to seeing. So that's just the tip of the iceberg. So we're dealing with a number of new clinical and research issues, all because of climate change. In addition to that, I'm the director of the WHO Collaborating Center in Children's Environmental Health. It's one of 12 centers worldwide that focus on children's environmental health. Again, there's a big climate change component with this center. And our priority with the WHO is educating, healthcare providers worldwide and the community at large on children's environmental health issues, with climate change being a huge one right now, trying to spread the message about, I should mention the reason we work on this is because of the vulnerabilities of children, because they are growing and developing so rapidly, because they are so susceptible to everything they're exposed to. Whatever we think we're exposed to, if we're exposed to a wildfire and the particulate matter in the smoke, they are even more vulnerable to the disease and health risk that comes with it. And I can address that more later, but that should do for now.
Thank you, Lesley. So we'll move on to our first panel question. And this question is for all 5 panelists. In the wake of the COVID-19 pandemic, there's been a lot of buzz about a green recovery or a COVID recovery plan that centers environmental issues. Well, what does a green recovery look like in your perspective? And we'll start off with Manvi.
Yeah, thank you so much. Great question. Interestingly, with COVID, my health side coming out, I'm actually the lead research assistant for one of the national studies on COVID-19 and how Canadians, like particularly communities, are responding to it, and like how, like what their experience has been. In particular, I was working in what is currently Ontario, where I originally live with my family, and I went to University of Waterloo for my master's, where I started this work, and I was working with like racialized communities, in particular the South Asian community, which was actually one of the hardest hit communities in Ontario, and the most, like, it was just a lot of racism they encountered with all the celebrations and a lot of the press coverage and media coverage, and it was really interesting to hear their perspectives. And one thing that I will say is that climate change did not come up because people are dealing with like more emergent crises, like more urgently threat to lives. So I think one of the first things that I always say from a justice perspective is like, let's address like the basic needs first, because that's only when people are able to actually be a part of the conversation that's necessary to move in the right direction. So that means like everyone needs healthy food, everyone needs shelter, water, like we need basic income, we need social security nets. There's so many things we need so that the people that are the most structurally vulnerable to the impacts of climate change, particularly on their health and well-being, can actually engage in the conversation and be stakeholders that are informing the policies that will actually help like protect all of our communities. So the first thing, it doesn't sound like climate policy, but it is climate policy, is like public health policy and all the other policies that we need to like make sure people are living and thriving in their communities. So that's like the first thing that I would say. It doesn't sound like it's like what we need. It's not the buzzword. It's not the catchy emissions mitigation stuff. I think that stuff is really, sometimes we lose our way with those things, jumping to them like, oh, we have certain targets, certain things to meet, but you're forgetting that there's the big part of it. For me, my worldview is always that there's people being impacted. And so if you're taking that lens, and of course, land and environment, animals, like ecosystems, all these things. So if you're trying to be considerate of those things and taking a human-centered approach with health being the forefront, it means that everybody is given the opportunity to live and thrive. And then only can we work together to kind of move in the direction of all this stuff, but it has to happen really quickly because we also have to emissions mitigate. We also have to adapt. Like that's a given, I think. But for me, working with communities in health, I know that there are way more pressing, more urgent needs and things that have to be addressed. So unfortunately, a lot of the time, you're very privileged to be able to engage in conversations about climate as your forefront concern. People are dealing with a lot of other things more urgently, and they're unable to be a part of these conversations. Yet they're also the communities that are being asked to be the most resilient in the face of like all these compounding vulnerabilities that are, present to them and that they're forced to experience. So those are just some quick thoughts, but I'm sure my panelists, like fellow panelists, can expand in other directions as well. But COVID just kind of reminded me that, there's a lot to have perspective over about, how we should approach the green recovery and the just recovery. All of those things are needed, but we have to put communities first. I think that's my thing.
Yeah, thank you for sharing, Manvi. Jason, do you want to add from your perspective onto that?
Yeah, I think one aspect that a lot of people talk about disagreeing, I think going back to like my master's research on like viewing things, maybe try and view things in a different light. So going back to the business as usual approach, as I feel like a lot of times when we talk about this green recovery plan, I think the root of it is like kind of how our economic system is set up into that. As a lot of times it's kind of more, our economic system is a more neoclassical economics approach, which views which neoclassical economic time view environment as like an infinite amount of resources, which that's not the reality. and that even gets into talk when we're talking about sustainability, because of that neoclassical thought process. We kind of step into when we talk about like people organize like countries, municipalities, talk about sustainability, they kind of more talk about more of weak sustainability, and weak sustainability kind of looks as like natural capital and human connections and stuff like that as two separate entities. They don't see the interconnections to one of them, and that's with the mindset of thinking that there's an infinite amount of natural resources, or we can replace that with human or manufactured capital. We don't have to worry about the natural capital because it's infinite, which is not the reality as like with when you talk about, so that's like kind of talking when you talk about this green recovery kind of having more like a strong sustainability perspective that looks at like, like it's very connected to one another. So that's like with ecological economics, it has a focus on like how it's more systems thinking. It looks like how it feels like the economy as a subset of the overall biosphere, the overall environment, and that's why a lot of times, like my experience with talking to economists, it's fully keep telling them like, the environment, like the whole reason our economy is thriving is the environment. Where do you get our resources from? It doesn't come out of thin air. And I think that's kind of for sure how we need to view, how we need to start maybe changing our thinking. That's a big paradigm shift into like changing from the neoliberal, neoclassical economics thinking into like, I would say like ecological economics, but that's kind of a big portion. And like with that builds on going like what my research on focusing on more alternative measures to well-being that has more of a strong sustainability perspective. As Manvi talked about, a lot of these communities are dealing with all of these different aspects that affects their well-being, and that's not really like incorporated into these kind of sustainability initiatives. And I feel that it's very problematic. And that's kind of like, we need to start looking at, or if we talk about communities implementing sustainability, I put quote unquote sustainability initiatives, it's usually sustainability for the rich. I like to say a lot of times, like you see sustainable infrastructure, green infrastructure projects and stuff like that. That's happening in more of the urban areas. So I bring my rural Ontario perspective, because I know that a lot of these kind of stuff was like more in like urban areas. Like I live in downtown Toronto. I see the big difference in like green infrastructure in downtown to other communities that's racialized. They're not getting the same priorities. Like you have the bike lanes, you have the green building designs in downtown. And I don't want to get to it because I got into an argument about an urban planner about this very thing when they're trying to brag about their sustainability in, like, I think it's a city in York, one York region. And I called them out and they were just like, we don't treat, it was just foolish in their perspective, their answer, but it's like, this is the problem with people like this, that they don't see the problem. And then that's a lot of times, it's probably, you have to look at, when we're talking about this green recovery plan, I think we need to like overall need to change this thing. We can't go at a business as usual approach into this. And I think that's a big problem when I see a lot of government people, government bodies and talking about it, they don't look at those different aspects. It's still number one priority is GDP. And that's a problem. And I think the COVID kind of highlight where we prioritize money over people's health, there's a problem. And like, I don't want to be that person. Like, I feel like the only way you can talk to them is to like use words like human capital. What about our human capital? It's like, I don't want to view them like that, but for some reason, for a lot of times, like these people, they probably view them as like, you need to put like at a capital monetary perspective. That's the only time they probably will listen. And that's like, I hate that, but that's kind of like the problem with this kind of perspective. But yeah.
Yeah, thank you for sharing. That's definitely a multi-pronged problem that needs a multi-pronged approach. We will move on to Lesley next.
Hi, I'm enjoying everybody's answers so far. I'm going to keep my answer very simple because I know there's a lot of people who work more in policy than me here, but from my background, moving forward with green recovery research is my answer. It's essential. It's because of research that we can truly quantify how bad climate change has become, not just in numbers, but in terms of health, both physical health, mental health, emotional health, in terms of social problems. And I think we have to just keep pounding away at the research to show where we are, to show any improvements we make, no matter how small, no matter how gradually. and to continue to inform policy, because all good policy is based on research some way, somehow. And that would be my, from my background, my work. Like I said, I don't make policy. I love creating work to hand over to policymakers and politicians and say, here, do what you will. And I love to see what they come up with. And then I, in turn, vote for people that I feel like have used that knowledge well and righteously. So my answer is research is an incredible point moving forward.
Yeah, thank you. Yeah, I mean, we need to know what we don't know in order to progress forward. Exactly. Peter, if you can offer your thoughts, and then we'll move to Bella for this question.
Absolutely, thank you. And I agree with all of my colleagues who've spoken, particularly Jason and Manvi. The reality is the traditional way of looking at a green recovery to handle the climate crisis needs to be taken in consideration with the parallel crises that we're living through. The crisis with COVID has shown the lack of investments for our healthcare sector that are absolutely essential. And anyone who has been to a hospital over the last few months, you know how healthcare workers are absolutely stressed to the maximum, and many of them are having to deal with other healthcare workers that are off because they're sick. Our hospitals are stretched beyond the limit. And so we need to be thinking first and foremost of not only our healthcare sector and reinvesting, so we build up our hospitals and our healthcare sector to the extent that we need it, but also expanding healthcare so that things like pharmacare and home care and dental care are taken into consideration. And that leads to the second crisis, which is the crisis of inequality that Canada is seeing. We have levels of inequality we haven't seen in a century. We've seen billionaires during this crisis benefit enormously, tens of billions of dollars, and yet they often don't even pay anything remotely fair, their fair share of taxes. And so putting in place measures that really help people who are the most marginalized through this pandemic to fight back against the massive inequalities that we're seeing are absolutely essential. The guaranteed livable basic income. People with disabilities that I see, my wife and I grow food for the local food banks here in New Westminster and Burnaby, and the food bank lineups are the longest we've ever seen. The number of homeless on our streets are bigger than we've ever seen. That means we need immediate investments in housing, and we need immediate investments to make sure that people are being supported. So that crisis of inequality is part of the green recovery, right? And that comes back to then what is the most traditional way of a green recovery, which is making investments so we shift to clean energy. The smart grid, investing in clean energy. In Alberta, we have hundreds of thousands of capped oil wells that are not being used, that are an environmental hazard, and yet they could be transformed into geothermal energy in very short order with the right level of investments, and energy workers could be transitioned to do that work. And so what we have is a series of crises that all come together in what is a plan that needs to build back better, that needs to build back in such a way that we get the environmental sustainability and the fight back against the climate crisis that we need, but also a more equitable society that Canadians are looking for because they've seen the ravages of this COVID pandemic, and to reinforce the healthcare sector, absolutely essential, and to expand healthcare so that people are covered from the top of their head to the soles of their feet. We no longer should make a distinction around what type of healthcare is offered through our public system. We need to make sure that people are fully taken care of.
Thank you. Thank you for sharing, Peter. And yeah, I live in Alberta, so I definitely agree with that. Bella, if you would like to share.
Yeah, thanks everyone. I love going last. All the good points have already been made, so I can just agree with everyone. I'm coming from an urban perspective. I'm so sorry, Jason. That's just where my work takes place. But I think I agree with what everyone has said. Like, this needs to be a different approach. It needs to be radically different. The way that we manage, the way that we plan our cities, it has to change. We have to dream bigger. We have to imagine outside the bounds of what our society currently provides for us. And I think when we look at the current plan for the Green New Deal, like there's a lot of good stuff in there. There's a lot of stuff about green infrastructure. And I think what Manvi said was like really key. Like we can't just build green infrastructure, and what Jason said as well, we can't just build green infrastructure and allow environmental gentrification and environmental injustices to continue to take place. There needs to be addressing of these basic concerns. Canadians need to have houses. There needs to be housing security, there needs to be food security, there needs to be income security, and all of that has to be part of it. And then we can address the climate crisis. And so I think Leslie was absolutely correct in saying we need this research, like we need to know what's going on. So I won't take up too much time, but yeah, I think we need to reimagine how we're addressing these problems, because I think if we can invest in people and we can provide green infrastructure and we can create radically different cities, I would love no cars, but maybe that's a little bit too much. Then I think that thought gives me hope, is what I will say.
Thank you, Bella. Yeah, I think hope is very important to keep. It's something that, sometimes people just see as fluff, but it can really be a driving force in creating change and empowering people. And you'll be going next for this next question. So how do you see health in a holistic perspective being impacted by the climate crisis, and where do you see it going in the next decade? And if you want to talk about scientific literature on ecosystem services that suggest health in relation to climate change, you can go ahead.
Yeah, I'm going to come at this from a very ecology-based perspective. I don't have the experience in health that Manvi and Leslie bring, so I'll leave that to them. But we benefit so much from our contact to nature, especially in cities when we're living in areas that have so much less nature than maybe in rural areas. And as climate change progresses, the quality of our natural areas is going to suffer. And when that quality suffers, our health will suffer. And so if we do not take radical acts to mitigate climate change, it is a snowball effect. If we lose our urban forests, that is a big problem. Trees are doing things that we don't know. They're doing it without asking. They do it without thanks, but they are really helping us all the time. And so is the rest of our nature. And so when climate change affects those things, it affects our health in a big way. But that is all I'll say on that, because there are some very smart people on this panel.
Thank you, Bella. Leslie, if you would like to go next, then you have free reign to talk all about your research now.
Oh, fantastic. I'm so glad you let me follow Bella, because I loved what she said about trees doing amazing things, and they do. And when you talk about holistic health, you talk about the whole person, and it's so multidimensional. And a key part of holistic health is the participant being involved in their health. And if you ask people if they wanted to live near, a parking lot or a playground with lots of trees, I think we know what everybody's answer would be, right? It's amazing. But something I really wanted to touch on, and I'm so glad that this question allows it, is the climate crisis is so damaging to everyone's health, but we have not acknowledged the damage it's doing to young people. And when I say young people, I especially mean the very young, but when I also include youths. And there was an incredible study that coined the term eco-anxiety that's now being used commonly in young people. And they have this incredible anxiety about what's happening because of the climate crisis, and they have no control over it. And there is actual deep-seated anxiety. There was a study that showed up to 70% of people aged 16 to 25, which is not children, but much of your audience here today, feel sad, up to 70%. So 50 to 70% feel sad, afraid, anxious, angry, and powerless about the changes in the environment. So much so that they're having to see psychologists, psychiatrists. They're that panicked and anxious about what my generation and older have left them with, and they feel completely powerless to do anything about it. And that breaks my heart. I think that's horrible. That's a huge effect on mental health. And one of the only solutions it's not a solution, but to help them is to give them some power over it. So in my mind, moving forward, the next decade, look at your generation, look what you guys have done today, is to start giving your generation more power. And it will help your holistic health. But guess what? It's going to help the environment because you guys care more than any generation to date. So just like Bella said, her research is amazing. Research like that going on is amazing. You give the younger generation an opportunity to step up, do the research, make policies. They're going to make changes. So that's where I see the next 10 years going in holistic health. Your generation cares far more about holistic health than past generations. So thanks.
Thank you, Lesley. Yeah. Manvi, if you want to offer your thoughts next.
Yeah, I thought I was going to go last. I was excited to hear all of them, but yeah, I'll go. I'm really happy to go. Yeah, this is like what I think about. Well, Lesley, I'm 24. I've been crippled by all those feelings. I already have generalized anxiety and depression, ADHD, but like throw on eco grief, like let's, keep it going. But no, it's serious. It's a serious issue. And that's kind of where like a lot of the best spaces to be in. I mean, I've talked about this, I think in other publications or whatever, like other events and stuff, like just straight up eco grief and eco anxiety, eco depression, throw the prefix eco on it. We've all felt it. But like, I think the biggest thing that's helped so many of us is finding community, finding community in organizing and doing community organizing, like being involved. And so I think that it's so great, like organizations like YCL, Shake Up the Establishment, like there's so many different groups you can get involved in, CCC, like Jason, your group, and within across Canada, we actually have a map on SUIT's website. It's called Map the System. You can find your local group all the way across what is currently Canada. So if you want to get involved, anyone, that's like the best place to go because everybody else feels the same way and you can feel like you're actually doing something about it. And otherwise you'll kind of feel like sad about it. So I just want to say like, yeah, I feel you very much so. And yeah, I go through phases where I'm very much like, oh no, this sucks. I don't know what's going to happen. And then I go through a phase where I'm like, no, it's okay. We got this, So all of that's valid. The one thing I tell people is don't, like my one friend Kira, who's actually works with Jason in Community Climate Council, she taught me like there's this one study that they did and there was like a cycle, and the cycle of eco grief is very similar to like the cycle of like just grief, and like one of the things you can pitfall into is straight up depression. And as somebody who has clinical depression, I know how debilitating that is. So don't go in that, like don't fall off the wheel, just keep cycling if you need to, and like keep getting involved and like know that there is hope. But yeah, in terms of health, kind of forgot the original question. I'm going to blame the ADHD, but what I will say is that the science is there, like Western science, Indigenous traditional knowledge, ancestral cultural knowledge, like all kinds of knowledge. It's what I study. Everyone's basically said that there are health impacts. One of the most convincing frames for climate change to motivate and minimize the attitude action gap is to frame climate change as a public health crisis, because it is one. It's the one that spurs the most action from people that are probably the most care but don't do anything about it, is to really frame it as a public health issue. There's literature on that as well. So I think the biggest thing I could say is that the evidence is there, I won't say just science, I will say evidence, because I want to include like the lived experiences of the people that are like the communities that are already feeling it. Like, it's not like it's a future thing. It's being in what is currently Vancouver. Peter accurately summarized it. The day I landed here and moved here was the heat dome day, and like 700 people or so were impacted. Hundreds and hundreds died, and the coroner said that would not have been a thing if it wasn't for climate change. Since I've been here, I've driven through a tornado. Didn't know there was going to be one. It was just in the middle of it, and I was like, wait a minute, this is a tornado, like fully a tornado. And then they later said there was a tornado that I drove through. And coming back home from UBC campus one day, there's been fires, floods, we called emergencies for those. Like it's getting to be to the point where it's not a question anymore of is there health impacts. It's like there are health impacts, there are here, and they're going to keep getting, worse and worse. So let's do something about it. And I think the thing that we need right now is climate communication from all all places, all the time. You know, throw the climate lens on everything and make it about climate. It sounds annoying. Sometimes I feel like it is a little annoying, but like I love it, because the more and more that we get people to care about it, you know, you'll see it change at every level, municipal, like even like local, municipal, provincial, federal, and just every little bit counts, you know, because you don't know how far that action is going to go. So get involved. Talk about climate, annoy people, annoy people, just talk about it all the time, get it on the table everywhere you go. And I feel like that's like the way that we both help ourselves feel better and also actually like move the buck forward, because sometimes I feel like we are talking amongst ourselves, people that already care about it, know about it, but we need to talk to people that don't know and don't care, or maybe they would care, but they just don't have access to the knowledge that we do. And I think that that will spur a lot of, you know, community organizing and mobilize like action on different levels, you know? So really like scattered answer, but there's the health impacts are well documented. I won't, you know, bore people with that. What I will say is like, let's do something about them, because it's getting very urgent and will be worse and worse, increasingly so. Not to sound, you know, glib, but I'll pass it off.
Thank you, Manvi. That was great. It was very scattered, but it was very like grounded at the same time. It made sense. Moving on to Peter. And I'll just say the question again. How do you see health in a holistic perspective being impacted by the climate crisis, and where do you see it going in the next decade?
Oh, thank you. And Bella, Leslie, and Manvi have responded really, really effectively. So I'm not going to add to their excellent points. Just to say that one of the aspects of the Green New Deal is to look directly at ensuring that restoring our natural ecosystems and restoring those ecosystems that have been threatened or endangered. And so that issue of a more holistic approach is something that provides more support and more ties for people and nature. And this comes back to Leslie's point about mental health issues. The worst thing that can happen is to have a society where the government is not responding to crises that people see right next to them. And what we have is a climate crisis and a government response that has been to continue to provide supports to oil and gas, the oil and gas sector, massive subsidies, instead of making the investments in clean energy. And so when we talk about expanding healthcare so that it covers everything from the tip of the head to the soles of the feet, that includes mental health supports, and that includes a government that actually responds to with the size and scope of what is needed to respond to the climate crisis. Mental health supports are vitally important, and also providing supports for addiction. People who are contending with addiction, we've seen with the opioid crisis in British Columbia and right across Canada, thousands of people who've died tragically. What we need to do is reorient our priorities. So our investment is in people, and our investment is in our environment and fighting back against the climate crisis. That means a full holistic healthcare system, and it also means providing supports to fight against addiction. So many people struggle alone, and the resources are simply not available. And that needs to change. These are the kinds of lessons that we're learning through COVID and through the catastrophes of the last few years. Coming out of COVID, we really need to have a new orientation for our healthcare system and for our society at large.
Thank you so much, Peter. And to end off, Jason, if you want to add your thoughts.
Yeah, I think everyone said everything. But I guess I will kind of approach this. This is kind of related to Bella, talk about ecosystems, maybe goods and services, and the importance of it. Because I don't think a lot of people realize how it has it's very much connecting to like health, as like how they're like characterized is like how it helps with food, fresh water, purification, disease regulation, all this kinds of stuff, like how they have such kind of these importance. And a lot of times, like, I think there's even with this health, putting in a health perspective, like maybe how we should have municipalities create like a natural capital asset management plan, as to look into more into that, and like kind of connect that to the public health, because like with if I'm sorry, trying to put this all together because it's like it's multi-purpose. It's like it's very much interconnected, as like feel like having this asset management plan, like looking like all the costs of like having these ecosystems in relates to like public health, like how that relates to like reducing public health costs and stuff like that, because how they're very much integrated. Ecosystem business services is, a lot of times don't realize, it's very much integrated into our overall well-being in society. And I don't think that has been pushed a lot into that. So that could be like, hopefully like our approach that we can see. Like there are municipalities that are talking about it with their climate change action plans of doing like more natural resource, natural capital asset management plans. So that's like we're going to that approach, but hopefully can hopefully see this being put more into the public health perspective. And I kind of maybe even talk about more of, I actually worked at TRCA as a research fellow doing around eco-health indicators, and how I feel like there's not much done with it. I think Manvi, we actually talked about this, I think before a while ago, about even kind of your research of like, they're not really incorporating environmental stuff into the public health agencies are not really much incorporating that. And that's kind of what I was like looking into like first year in my master's. And it's not, and even from when I did like talks with these organizations, public health organizations across Ontario. Yeah, I don't know what, that was like 2017. So I don't know if it has changed at all. So that's kind of probably an approach that hopefully they can do that interesting public health.
Thank you all so much. Our next couple questions are going to be taken from audience questions. And our first question is directed at Peter. Oh, sorry, one second. So our question is, what is your view on rehabilitating old infrastructure to create homes and safe consumption sites? Many new green buildings are being put up, but what about run-down buildings, especially in low-income areas?
That's a great question. And this is where transforming our economy in a way that guarantees environmental, social, and economic justice is so important. A key component of that is retrofitting of existing buildings. And there are buildings that simply can't be renovated or retrofitted, but those that can, the resources need to be brought into bear to make sure that that retrofitting takes place. And you'll recall about 20 years ago, a former government actually put in place a temporary energy retrofitting program. It was oversubscribed within a matter of weeks, and that government actually ended the program because it was too popular. Too many Canadians wanted to step forward, offering the same type of program for community groups to retrofit and to renovate existing buildings, for individuals to do that, families to do that, for multi-family buildings. That is absolutely fundamentally important for us to make that shift towards the Green New Deal. So yes, we need to put in place programs so that community groups, families, multi-families can all benefit from retrofitting and the energy retrofitting of buildings, which saves some money in the long term and also helps us to combat the climate crisis.
Thank you so much. That's a wonderful answer and a wonderful point to bring up from the person who asked. Our next audience question is directed at Lesley. Our person would like to know, which areas of social inequality do you find need to be prioritized first through research and planning?
So this is such a great question, and it's a really hard question. If I were to look at it sort of within the context of the climate crisis, because there's so many ways to approach this question, one of the biggest challenges I would say is housing. Food security is right up there as well, especially because if I look at food security for second. Say our Indigenous populations, for example, because of the climate crisis, they're no longer able to access, many of them, their regular food sources. They're running out. They're not able to hunt and fish, for example, where they would. So in some cases, certain vulnerable populations have become even more vulnerable. But right up there beside that is housing. Because I'm thinking of children. My first priority is always children. Not that I don't care about adults, I just care about children more. And for children, housing is such a vulnerable situation. If they don't have a good home, they already have more environmental exposures on them. They have overcrowding. They could have mold. They could have, VOCs, off-gassing. So they already have so many environmental issues if they don't have a good home, that the climate crisis just compounds those issues. Then they have extra pollutants. Then they have, if they have a natural disaster, it just compounds their life so much. So I would put housing and food security right at the top of my list. Not that there aren't many others, but those would be my two main answers. Yeah, great question though. That one could be debated for hours.
Yeah, that's some really in-depth questions today. But thank you so much for that insightful answer. We then have a question here that could be for any panelist who would like to answer. But related to health is that food systems are a huge factor for both health and climate. Has anyone on this call taken action on food system transformation?
I think I can jump in on this.
Go ahead.
Actually, this is more for the Community Climate Council, as we I think this is a project that Manvi mentioned Kirad. This is like one of her big projects, but I was hoping on her talking about the issue of food security within Peel Region. I'm particularly focusing on Brampton and talk about implementing community fridges into the city. As we're talking about, that's kind of been a big problem of food security, especially it's been amplified because of COVID. So that was like a big problem that we noticed. So that's kind of like a project that CCC has been working on, but at the same time, we're dealing with issues of more of the urban planning policies that we had to go into about like how, and I guess the safety of these stuff. But that's kind of like food security. We just realized like we've seen a lot of communities like in Toronto having these community fridges implemented and it's been very successful. And we just want to replicate that for Brampton. But I think like a big problem we're witnessing that. And also connecting that to like community farm. That's kind of one of our other projects that we're thinking of putting into Brampton, having a community farm so people have access to fresh foods and stuff like that. But it's a lot of hoops we had to jump through, a lot of like red tape that we had to go through to hopefully implement that. So that's something that we've been discussing about, but that's been hopefully something that we will be dealing with very soon.
Oh, that's amazing. Thank you. I can see that Peter has his hand raised.
Thanks very much. Just to add to Jason's excellent answer, what we have right now is not a sustainable food system. When you think that we ship fruits and vegetables around the world, the huge costs in terms of greenhouse gas emissions, but also not establishing the sustainable practices that should exist for sustainable food supply in each of our communities. In the Lower Mainland of British Columbia, we have it's called the 50-mile diet, which is to endeavor to eat products that are within 50 miles of our jurisdiction. And what that has helped to do is help people see our food system in a different light, rather than part of an industrial agricultural system, really looking to local small-scale farmers, trying to maintain a much more local approach on food. And so there is in terms of the climate crisis, a different way at looking at food that's more sustainable. I wrote in the chat box an answer in terms of what the Green New Deal talks about, but we need a better access to safe, healthy food for people, and we need to reorient towards more local production so that we can help to mitigate the impacts of shipping food all around the world with the huge greenhouse gas emissions that result.
Thank you so much. I'm going to pass the question to Bella, who has her hand raised, and then we will need to move on.
Yeah, I would be bereft if not to comment while sitting in Newfoundland, which is perhaps one of the most food insecure places in Canada. At any given time, there's 2 days worth of fresh food here. And climate change all our food comes on ferries. And climate change is making that increasingly more impossible. So when the weather is bad, I mean, the weather's always bad in Newfoundland, but when it's extremely bad, the food can't come and the prices have skyrocketed. And these are problems that are being faced in all of isolated or remote communities in Canada. We need long-term solutions. Like, we need technology on this. We need to be more food secure. I have eaten apples that have traveled to places that I have not been, which feels unsustainable to eat an apple from New Zealand. So yeah, yes, thank you for your points, Jason and Peter.
Awesome. Thank you so much to all of our panelists. We've had such an amazing discussion today. We are going to be wrapping up our question and answer, but we do have a couple of final things to share with you before everyone heads their separate ways. So for starters, we have kindly been given some social media ways that you can reach our panelists. If you would like Leslie's email, please reach out. But this is how you can reach all of our panelists if you have more questions that they didn't have time to answer. You can also feel free to contact us at both IISD and Youth Climate Lab if you have questions about future similar events we might be having, or both of these organizations are always open to collaborating with young climate activists, and you can always reach out on that too. Now, last but not least, we did promise that a few of you would be winning door prizes, and this is indeed the case. 3 of you who are on the call today are going to be given a $75 gift card, but you can choose where it's from any of these 5 places. The winners are going to be contacted directly via email, so that you can let us know which one of these 5 places you would like your gift card for. We are also always looking for feedback on how we can make future events like this even better. So if you scan this QR code on the screen, you will be taken to a quick feedback survey so that you can help us at IISDxYCL do even better on future events. So thank you all so much. We had a wonderful day. Another huge thank you to all of our panelists. And I just hope that you all have nothing but the best in the new year.